Hi, I'm Dr. Tobin, one of the ear, nose, and throat doctors with Ohio ENT and Allergy, and we're going to talk today a little bit about ear tubes, which is obviously a very common thing that gets done in an ENT practice, and we see lots of young families with babies who have ear infections, and we get a lot of questions, so I thought I would talk about this briefly. Ear infections are common in babies. 80% of babies will get ear infections, mainly because their eustachian tubes are still developing when they're born, and they're angled a little bit differently. And the eustachian tube is what equalizes the pressure behind the eardrum. And it's the eardrum and the ear bones that amplify the noise that we hear. And we have an airspace in there, and our body in general doesn't like air spaces, so we have a eustachian tube that equalizes pressure. Babies' eustachian tubes are developing, their immune system is developing, they're getting more colds, and all of those things lead to fluid that can collect behind the eardrum, and fluid can lead to ear infections. And any parent will tell you it's not fun. Ear infections cause fever and pain and irritability, and it can cause hearing to drop and can cause speech delay. And for all those reasons, we want to treat ear infections. And the first way to treat them is with antibiotics. And antibiotics are wonder drugs and can get rid of infections, but they can cause problems as well. They can cause GI problems and allergic reactions, and for a lot of reasons, we try to avoid antibiotics when we can. And so we've got this balancing act. We've got the child who doesn't feel well and the infection, and we want to treat it, but we don't want to do multiple rounds of antibiotics. And so the children that are getting repeated infections are the ones that come to the ENT doctor. And what we'll talk about is an ear tube. And what an ear tube is it's a way to bypass the eustachian tube, to equalize pressure where it needs to be equalized by putting a small opening in the eardrum. And so what we're doing when we do an ear tube is we're putting a small little polyethylene or silicone tube right into the eardrum so pressure can equalize across that. And so that's the first thing that it does, is it maintains normal pressure, and that should reduce the number of ear infections. If an infection occurs, it can drain out through the ear tube, so immediately there's no pressure that builds up and the infection can get out. And this is probably one of the best things, and parents don't think about this, is it gives us a way to get the antibiotic into the space where the infection is without having to do oral antibiotics that expose the whole body to the antibiotic. So we can do medicated ear drops that go in the ear canal, and then with just a couple little plunges of the ear flap, the drops can go through the tube right to where the infection is, and then we can avoid almost all oral antibiotics. And we understand as ENT doctors that ear tubes are a surgery, and that can sound scary. And I've been through this myself. One of my kids had ear tubes, and the procedure is very quick. It's done under a very, very quick anesthetic. There are, newer techniques where doctors are trying to put ear tubes in the office, and that sounds interesting and is probably very necessary in certain cases, but most of the time, if you ask an ENT what would they do for their own child, the brief anesthetic is what we would choose. Why? Because it's painless and there's no recollection, and we can very carefully place the tube exactly where we want it. And it also lets us, under a brief anesthetic, wash the ear out, get the infection out. There's usually trapped mucus and sometimes pus. We can wash that out, and then we can carefully get the tube in and then put the medicated drops in. And so for all those reasons, if we get to the point of putting in ear tubes, then we want to do that under a brief anesthetic. The tubes generally stay in for about a year to year and a half and fall out on their own. As I said, children can still get ear infections, but they can drain while the tube is in. Rarely the tube doesn't come out when we want it to, either too soon or stays in too long, and then we can remove it or replace it if necessary. But usually we get our year to year and a half out of them. Tubes come out, the child outgrows the ear infection, and then we're done. 1 out of 5 children who gets ear tubes will have ear infections after their tubes come out, and we will consider a second set of ear tubes. And in those cases, we might consider a second procedure that's called an adenoidectomy. And an adenoidectomy, that's a procedure that's trying to actually help the eustachian tube to work better, because the adenoids are located down at the lowest end of the eustachian tube, and when they get big, usually in kids that are 3 and 4 years old, they can block the eustachian tube and also cause stuffy nose and sinus symptoms. And so you'll hear about adenoidectomy. And you'll sometimes also hear about tonsillectomy. Tonsillectomy is not generally done for ear infections, but we do tonsillectomy in children who have snoring, sleep apnea, recurrent strep throat. And I'll give you a little teaser to a video we'll do later talking about different techniques for tonsillectomy, but there's the way that has always been done, which is take the whole tonsil out, which has been done for 100 years, but over the last 10 years now we've looked at removing the tonsil but leaving the outer layer called the tonsillar capsule, and that reduces the risk of bleeding a great deal and reduces post-operative pain. And so that's something that our group, Ohio ENT and Allergy, has actually published on this technique, and it looks to be a very good technique in the right patients. And so that's something that you may hear us talk about. And one last thing that I will say that's kind of an interesting historical note is ear tubes were first done in the 1950s, and it looked like it was a really great idea and was working well, but it was a doctor in Ohio ENT and Allergy named Dr. Don Gebhardt in 1981 who did a very large research study actually proving that ear tubes reduced the number of ear infections in children. And that study is still out here. Our group wasn't called Ohio ENT and Allergy, but that is a kind of a neat historical thing for our group, that one of our doctors, produced a landmark study proving that ear tubes did what we thought that they did. So we're here to help you. We take care of little babies, older kids, adults, old folks who need hearing aids, all age groups, and we'd love to see you for your ear, nose, and throat problems. Okay.